Smoking is the single most and significant cause of illness and death in Australia, and yet it is also the most preventable cause of illness. This is due to tobacco smoke containing over 7,000 different chemicals, of which over 70 of these chemicals can cause cancer. When tobacco smoke is inhaled, these chemicals enter the lungs and spread throughout the body via the lymphatic system, which is located in the neck and throat region, where the smoke travels, thus increasing one's chances of developing lung cancer. Smoking is also linked to various other cancers and diseases such as cardiovascular disease, type 2 diabetes, and bone-related diseases such as arthritis. Smoking is also linked to reproductive problems in women, as smoking impacts the health of the unborn child and causes birth defects. Even non-smokers are at risk. This is known as second-hand smoke or passive smoking. As the body of a non-smoker is not used to the chemicals in tobacco, it has a greater effect and impact on their bodies. This is a great concern as the general public are non-smokers and they are exposed to seriously hazardous and life-threatening situations within their own environment.
Highlight and examine the social cultural factors affecting or contributing to tobacco smoking in Western Sydney in comparison to other areas of New South Wales and Australia. These social cultural factors we are going to go through include age, sex, socioeconomic status, cultural background, public policy, and also social groups.
Tobacco smoking is a leading risk factor for chronic disease and death, including many types of cancers, respiratory disease and heart disease. It is the major cause of cancer. It is accountable for 20 to 30% of all cancer cases in Australia.
Based on a report from 2011-2012 by the AHS, it had reported that nearly 1 in 6 people aged over 18 smoked it daily, approximately 16%. A higher proportion of men at 18% compared to that of women at 14%. This comes back to the idea of social cultural factors having an effect on whether you smoke or not. It can be seen that the rates of smoking are higher in the western parts of Sydney compared to that of other parts of Sydney, who had lower numbers of daily smokers. This will be elaborated on throughout our video.
And now we will head to the facts.
If individuals don't have a safe area to participate in exercise, they are more than likely not going to participate in physical activity. Therefore, they are more than likely going to participate in activities that aren't good for their health. This creates a high chance for these individuals to then participate in tobacco use, and there is around a 40% chance for individuals to start smoking on a daily occurrence if they don't participate in regular physical activity. Companies use packaging as a way for them to advertise and make it attiring for people to purchase their products. This can be seen with bright, fragrant colours or just package appeal. This meant that individuals from all socioeconomic statuses would like the look of them and then were more likely going to purchase tobacco products. The use of this advertising method was perfect for tobacco companies as it could be seen with the high rates of tobacco use. The Plain Packaging Act of 2011 by the Australian government was to help reduce the use of tobacco-based products. They used this by getting rid of any colour or pictures of tobacco companies on any packaging. Therefore, all you had was names and a dark bland colour like green or black, as you can be seen in this video. They also upped the amount of campaigns against the issues of smoking. Individuals with low income and low education levels are significantly more likely to smoke if they live in a rural or remote area, about 30%, to that of someone in a major city at 20%. Australian National Preventative Health Agency has suggested new ways to tackle the challenges of smoking, this being by focusing on young people who are at higher risk of smoking on a daily occurrence. Not only are rates of smoking higher in rural areas, but they have limited access to medical, general and specialist healthcare, lower treatment rates and longer hospital waits. This causes of the burden of smoking-related issues to increase, especially in rural and remote areas, to that of major city areas. Success with anti-smoking work in rural and remote areas must be a higher national priority than it has been in Australia to date. The Australian Bureau of Statistics in 2011-2012 found that 20.4% of males over the age of 18 smoked daily, compared to 16.3% for females over the age of 18 smoked daily.
Ultimately, this video aimed to highlight the health effects of tobacco smoking, highlight trends, and discuss the prevalence of tobacco smoking. This video also highlights the socio-cultural factors contributing to the burden of smoking in Western Sydney compared to other parts of New South Wales and Australia.
As mentioned throughout the video, there seems to be a disadvantage in Western Sydney and rural communities in comparison to their counterparts. Socio-cultural influences on smoking include coming from a lower socio-economic background, cultural influences, social norms, public policy, sex and age. Amongst these influences, there are disadvantages which can be addressed. Using the social model of health, it is important to understand the broader determinants of health and apply them to combat the disadvantages faced by Western Sydney and the rural communities. Social-cultural risk factors also need to be addressed throughout the intersectoral collaboration which can combat the inequality of living in remote and lower socioeconomic communities.
A major factor that must be also addressed is the inequity faced through education in these areas, as the social model of health indicates education and can reduce social inequities and empower not only individuals but also communities. Furthermore, enabled access to healthcare and knowledge in lower socioeconomic, remote and rural areas is a strong indicator of reducing the burden of disease and further preventing the onset of disease and illness.